Hi, my name is Bethany Aney, and I'm a child life specialist. I want to help you better understand your child's recent diagnosis of Crohn's disease. I'm sure that you feel overwhelmed with a chronic diagnosis for your child and have also probably received a lot of information, but might be uncertain about the next best steps in talking to your child about this. I want to help you feel equipped in knowing how to explain Crohn's disease to your child and helping them feel prepared for specific ongoing tests and procedures, in addition to you being familiar and understanding specific stressors they might experience with this chronic illness. So, Crohn's disease is a condition where the bowels get inflamed. This could occur anywhere within the gastrointestinal tract, from the mouth to the anus. Symptoms of Crohn's disease can include belly pain, diarrhea, nausea and vomiting, blood in stools, weight loss, low energy levels, and a few other things. These are all a result of the inflammation that occurs within the GI tract. According to Toon, Cripps, and Lobo in 2018, in one of their research studies, they unpacked and talked a little bit further about how Crohn's follows a wave pattern, and that there are times when the symptoms will increase and become severe, followed by periods of respite and less activity of disease symptoms. Typical treatment for Crohn's disease will vary depending on one's diagnosis and disease progression. However, the ultimate goal of treatment for Crohn's disease is to reach a point of remission of minimizing one's acute symptoms and being able to remain at a point of remission for an extended period of time. This could include the use of steroid medicines for the induction or beginning phase of treatment, or the use of a biologic agent that is able to target inflammation in the bowels, which would be administered through an intravenous infusion, through pills, and even sometimes including surgery. Additionally, the inflammation within the GI tract might cause damage within the bowels and the GI tract. Some of the various forms of damage that could occur are fibrosis, fistulas, stricture formation, and ulcerations being a few. The more familiar you are with understanding what each of these are, the more comfortable you'll be explaining them to your child should they have these results as part of the disease. So fibrosis is when the bowel walls become hardened and thickened with scar tissue due to inflammation and destruction of the gut wall. Fistulas are abnormal passages between two organs or an organ on the body's surface. Typically, they involve the vagina, rectum, vessels, and skin. Stricture formation is when inflammation and scarring causes narrowing of the intestinal tract, and ulcerations are open sores on the mucous membrane of the GI tract that causes a breakdown or disintegration of tissue. Your child's specific treatment plan will be discussed with you by their medical team. But for now, let's spend some time getting more insight into how you can explain Crohn's disease to your child to help them understand their diagnosis. To explain Crohn's disease to your child, it's important to use terms that are familiar to them and using concrete, simple words. It could be something like this. Crohn's disease is what is causing your belly to hurt. And this is because parts of your digestive tract, which help carry body throughout your food, become swollen, or inflamed might be a word that you hear, or an easy way to call it is angry. Your digestive tract could be anywhere from your mouth, esophagus, which carries food and liquids to your stomach, small and large intestines, and your anus, which is where your poop leaves your body. Because of Crohn's disease, you might have to go to the bathroom a lot because your stomach is hurting you, and you might have to poop more. You could also feel like you're more tired and don't always want to play with your friends or do your normal activities. Crohn's disease is called a chronic disease, which means it does not go away, but you might have long periods of time where you feel better. You'll most likely have to take medicine, which will help so that you don't have as much pain in your stomach. In addition to explaining it to them, you can also use simple pictures to help them visualize what the inflammation of the gastrointestinal tract looks like. You can find basic pictures on Google when you type in and search for Crohn's disease. This first picture that I'll show you just highlights the GI tract so that they can understand a little bit more about where they can find it. So here you can see it can affect the stomach, it can affect the colon, the intestines, and then down to the rectum. And then these other two pictures just show the inflammation that occurs. So in this first picture, you see the normal healthy intestine, which things can easily pass through because there's no blockage. Whereas over here, this intestine is affected by Crohn's disease. So it has that increased swelling, it has the thickening of the walls, fissures that are developing. And then this again is another picture. It just shows it from a different angle, a new perspective. So again, this is the healthy intestine, which is nice, round, and open, whereas this one over here, again, has the buildup and the blockage that's occurring with the fissures. And there's also a very simple activity that you can do with your child to help them have a hands-on experience with better understanding why the inflammation can cause pain or further issues. So for this project, you will need paper towel rolls or toilet paper rolls, scraps of fabric or scrap pieces of paper. You can use glue or tape. I personally use paper towel or toilet paper rolls that I cut in half so I could have two. And then I used crumpled up paper and tape. So for this, you need at least 2 paper towel rolls or toilet paper rolls, one to be the healthy intestine and one to be the intestine that is affected by Crohn's disease. So the one that is affected by Crohn's disease, you'll use those additional pieces of paper or other items that you will either glue or tape to the inside. So you can see that I glued and taped them to the inside there. You can see that it's creating blockage and it has thickened up the inside of this paper towel roll, and that shows the inflammation that occurs within inside of an intestine when one has Crohn's disease. Now with your child, you guys can find different objects throughout the house, maybe it's a marble, a bouncy ball, or a similar object, and pass them through each of the paper towel rolls and notice how much more of a difficult time the item could have passing through here due to the thickening of the sides and the inflammation that has occurred.